Hello everyone, my name is Ruxana and my student ID is S332938 and I'm a student of University of Suffolk. Today we are going to talk about children safeguarding in early years. This is a group presentation and in my group I have my colleagues Taylor, Fatima, Anisha and Hiro. In this presentation, we're going to talk about how the child safeguarding develop over time, real life cases, and the responsibility professionals have today. Child safeguarding is very important for children because they are dependent on adult to protect them. In schools, nurseries, and care settings, the professionals have a legal and moral duty to keep children safe from harm. In this presentation, we'll explain about everything. So my next slide is introduction of safeguarding. Safeguarding means protecting children from abuse, neglect, and exploitation. It also means helping them to stay safe, healthy, and supported as they grow up. Every child has the right to feel safe at home, in school, and in their community. Safeguarding is about making sure the right is protected at all times. According to Working Together to Safeguard Children, safeguarding includes protecting children from maltreatment, preventing harm preventing harm to their health and development, and making sure they receive safe and effective care. This means adults and professionals must work together to keep children safe. It's not only um, a responsibility for a person. No, it is a responsibility for everyone, like all the schools, teachers, police, healthcare staff, and the wider community. Safeguarding is not just about reacting when something goes wrong. It is also about preventing harm before it happens. This can include identifying early warning signs, supporting families who may be struggling, and creating safe environment where children feel comfortable and secure. Early help can stop small problems from becoming serious issues later. Listening to children is very important part of safeguarding. Children should feel heard, respected, and believed when they talk about their worries or experiences. Sometimes children may not directly say that something is wrong, but changes in their behavior or mood can be sign that they need help. Adults must pay attention and take concern seriously. Now I'm going to transfer to my colleague Taylor.
Hello, my name is Tyler. My student ID number is S332706. Um, I'm going to be talking about historical background. In the past, children were not always seen as needing special protection. During the Victorian period, many children worked long hours in dangerous factories, mines. They had very little legal protection. Over time, society began to understand that children were very vulnerable and needed protection. This led to early child welfare reforms and eventually to child protection laws. Safeguarding developed because of the mistakes and the unfair treatment of the children in the past. I'm also going to be talking about the emergence of safeguarding frameworks. Modern safeguarding systems developed after serious child abuse cases that showed weakness in professional practice. There were problems such as poor communication, lack of information sharing, and failure to act. As a result of this, a new guidance was introduced, including working together to safeguard children. This guidance explains how different professionals must work together to protect the children and identify the risks earlier. Safeguarding today is based on teamwork and shared responsibility to ensure that the children's safety and to protect them from harm and neglect. Modern frameworks also addresses risks beyond the families, such as peer-on-peer, online, and community-based schools and outside of the family. whilst ensuring these services are appropriate to those children's needs. I'm going to now pass on to the next speaker to discuss another important case and the laws that follow. Thank you.
Hello, my name is Fatima Ba, and I'm going to be, my student ID is S332542, I think. I'm going to be speaking about the Mary Ellen Wilson case and the Maria Colwell case. The case of Mary Ellen Wilson is widely recognized as the first officially recorded child abuse case to result in intervention in the state. Mary Ellen suffered severe neglect and physical abuse from her guardians in New York. At the time, there were no specific child protection laws, so authorities used animal cruelty legislation to remove her from harm. This case shocked society and proved that children require legal protection from abuse. Parents or guardians should not have absolute authority over children. Government must intervene when a child welfare is at risk. It marked the beginning of organized child protection worldwide. Legislation and impact this had led to creation of the New York Society for Prevention of Cruelty to Children, 1875, the first child protection agency. Development of early child welfare laws in the US and later influenced reforms in Britain. Recognition of children's rights as a legal and social responsibility. Long-term effect this had was modern safeguarding system and social services originated from this case. Maria Cornwell case, 1973, UK. The death of Maria Cornwell became one of the most important turning points in UK child protection history. Maria was returned from foster care to her abusive family despite warnings from neighbors, teachers, and professionals. She died after severe abuse by her stepfather. The public inquiry found poor communication between agencies, lack of professional training, and failure to share information between social services, police, and health workers. Her death demonstrated that abuse often occurs when authorities already know the child is at risk. Legislation and policy change. Maria Colwell case led to major safeguarding reform, like child protection system reform, creation of area child protection communities, introduction of multi-agency cooperation, development of child protection registers. The Children Act 1975 strengthened adoption procedures, court guardians representing the child's best interest. And then the Children Act 1989, the most significant long-term result, the child welfare became the paramount consideration. And the overall conclusion on both of these cases resulted in Mary Ellen Wilson created the idea that children need legal right and protection. Maria Cornwell case reshaped how government actively safeguard children through coordinated professional system. Together, they laid the foundation for today's safeguarding framework used by social workers, school, healthcare, and professionals and police. And now I'm going to pass on to the next speaker.
Thank you, Fatima. My name is Hiromi Allen. My student number is S333464. Now I'm talking about Victoria Cranby case. She was an 8-year-old girl who tortured and murdered by her great auntie and her boyfriend 2000 in UK. Why this case went wrong? Because even she was known to multiple agencies, such as 2 hospitals, 4 social agencies, departments, and 2 police children protection teams. Though it was failed in assessment and accountability, such as organizational malaise, lack of communication as hospital is closed, proximity, didn't access each other's record, and lack of professional curiosity, as practitioners accepted guardians' implausible explanations without further investigations. After that, Victoria Cranby's murder case, Every Child Matters, Children Act 2004, and Local Safeguarding Children Board were established. Next slide, please. And now I am explain about Legislative Foundation. Children Act 1989. This provides the legal foundation, and child protection and welfare is paramount. Next, Children Act 2004. This is provide the structure and organizational framework to ensure all agencies work together and emphasis on early intervention. Thank you so much, and I'm passing on to next my colleague Amisha.
Thank you, Hiromi. Hi, everyone. My name is Anisha. I'm going to speak about safeguarding today, professional responsibilities, and reflective practice with ongoing challenges. In slide 9, we are going to talk about safeguarding today. Today, safeguarding focuses on prevention and early intervention. It is child-centered, meaning the child needs always come first. Safeguarding ensures an environment where children feel supported and protected from abuse, neglect, and exploitation. Professionals now work together to reduce risk. Nowadays, modern safeguarding also includes new risks such as online abuse and child exploitation. Because in this digital world, people are more connected where awareness is essential. We need to support our children whenever they're using internet or anything because it becomes essential to keep an eye on them. Next slide, please. Professional responsibilities. All professionals who work with children must recognize signs of abuse and follow safeguarding procedure, as well as keep recorded, because if anything is recorded when any crime happen, we can find out easily. They must report concerns quickly and share information properly. Organizations such as the NSPCC provide guidance and training to support professionals. Everyone needs to be up to date about safeguarding procedure to keep everyone safe. Safeguarding is everyone's responsibility. Next slide, please. Reflective practice and ongoing challenges. Reflective practice means learning from past mistakes and improving our work. The Mono Review of Children Protection highlighted the importance of professional judgment. Today, challenges include online risk, exploitation, and limited resources. Ongoing training is essential. Thank you. Now I'm going to pass to my another colleague to wrap up our today's discussion.
Thank you, Amisha, and thank you all of my colleagues to put their thoughts and share the knowledge. In conclusion, I just want to say safeguarding has developed and improved significantly over time, largely because of serious cases in the past where children were not properly protected. In those days, in many of those cases, warning signs were missed, information was not shared between professionals, and agencies often worked in isolation. Unfortunately, those failures sometimes led to serious harm to children. Those tragic situations showed society that the system in place were not enough and that change was urgently needed. As a result, stronger laws, clear guidance, and better safeguarding system have been introduced to prevent similar problems that happening again. Today, safeguarding is more focused on early intervention, prevention, and ensuring that children's voices are heard. Professionals are trained, identify concerns, take action, quickly and communicate effectively with other agencies. Recording concerns properly and sharing information at the right time are now considered essential part of protecting children. This approach means that small issues can be addressed before they become serious problem, and children are given the support they need as early as possible. Protecting children is not the responsibility of just one person or organization. It requires teamwork and cooperation between schools, healthcare providers, social care, the police, and community organization. Every professional has a responsibility to act if they have concern and to work together to ensure the safe and well-being of children. Good safeguarding relies on clear communication, mutual respect, and shared commitment to protecting children from harm. In simple terms, safeguarding has come a long way because of past mistakes and lesson learned, and but it remains ongoing responsibility. By working together, listening to children, acting quickly when concerns arise, and following clear procedure, we can make sure every child grows up in a safe, caring, and supportive environment where they can thrive. And the next slide is about the references we used. This slide shows the research we used. Safeguarding must follow current laws. Thank you, everyone.